I know you wanted to add something regarding the vaccines.
Okay, if we can just stand still where we are at the moment, I think looking back, there are 4 issues that needs to be acknowledged. The first is, was the single treatment for each and every person necessary? And it's clear, and it has been clear since the beginning, that the risk of the infection for young, healthy people is very low, and many of the older people that were harmed and passed away had multiple other underlying conditions. Then the mantra of the safe and effective, which we've heard how many times over the last few years. If I can step on the effective, there's mounting evidence of negative efficiency. In other words, the more dosages you take, the more likely you are to get the infection. The other is that if you take it, it often precipitates an infection, and multiple publications now support that. The safety factor is the major factor, and comparing, especially in young people where the risk is very low, the administration of any treatment that has a higher risk than the threat of the underlying condition is well established now in multiple publications, and those publications are publicly available. A fourth aspect that's only become apparent over the last year or so is the presence of contamination of the content of the injections that's given to people, and they call it the DNA contamination. The risk of that is that the DNA becomes incorporated in the patient's genetic makeup, and that causes a high risk for the development of malignancies. And the incidence of very vicious advanced stage cancers in young people has clearly been escalating, and that is why everybody should keep these factors in mind if they consider this ongoing advice.